Hi, my name is Peter Miller, and I'm a colorectal surgeon with Colorectal Specialists, and I'm also the director of the colorectal cancer program here at Henrico Doctors Hospital. And I'm here to talk to you about the NAPRC accreditation that we received for rectal cancer. We are very proud of the accreditation that we've received. This is only given to the top hospitals in terms of rectal cancer care and indicates that we are very involved in making sure our patients have the best care. The rectal cancer accreditation is given to facilities that have a multidisciplinary team, which includes radiation oncologists, medical oncologists, surgeons, and we all work together to try and deliver the best care for patients. And there are rigid standards that are difficult to meet, and it took us about 5 years to get to the point where our program was able to meet those standards, and we're very happy to say that our patients are benefiting, and we're always pushing ourselves to improve that care. When you have this accreditation, it proves that your hospital offers the full array of options for rectal cancer patients, and that could be minimally invasive surgery, it could be radiation, it could be chemotherapy. And so when you've got a team of people working on your case, and every single rectal cancer case is presented at our conference in front of our experts, then those patients are going to get individualized care, which at another facility that isn't as focused, they might not get the same level of care. In terms of surgeries we offer, we perform over 90% of our resections for rectal cancer robotically, which is a big help for our patients in terms of recovery, and they're able to get back on their feet quickly after surgery. Rectal cancer is a cancer that we see in the last part of the GI tract, so the last 1.5 feet of the GI tract. And patients that have rectal cancer need an individualized treatment, and their outcomes can vary significantly based on where they get their care and who's involved. And we often, the treatment can often involve chemotherapy, radiation, surgery. So we know that when that care is coordinated, the patient's going to have a better outcome. They're going to recover faster. They're going to have a longer life expectancy. So we have taken that to heart and formed a team of specialist experts in care of rectal cancer, and this has allowed us to get that accreditation, which is great for the community, great for the patients. We are the first hospital in Richmond and the only hospital as of right now to receive this accreditation in rectal cancer, and we're one of 3 HCA hospitals in the country to receive it. So we were really out in front in terms of providing the best care for our rectal cancer patients. Rectal cancer or colon cancer can present with symptoms such as rectal bleeding, abdominal pain, unintentional weight loss. So if any patients are experiencing those symptoms, then they should seek care with their PCP or their surgeon. And any patient over the age of 45 should start screening for colon cancer. And some that have a family history would start even sooner than that. We have patients who have gone out to places like Hopkins or Duke and gotten a second opinion, found out that the treatment options that they have are the same, and so they decide to stay here for their treatment because they can get it closer to home.